Hi, I'm Victoria Sander, and I'll be presenting my research on the importance of early detection of breast cancer in Kenya. I live in Boca Raton, Florida, and I have a strong passion for public health and helping different communities. I decided to work with Polygence so I could pursue my interest in helping other communities and learning about different cultures. In Kenya, breast cancer is the most prevalent form of cancer and is the second leading cause of cancer related deaths. The high mortality rate from breast cancer in Kenya is higher compared to higher income countries because the disease is often not detected until it has reached an advanced stage. An implementation of the Pink Ribbons Nairobi is crucial. This initiative aims to empower women with knowledge surrounding breast cancer, focusing on prevention and the importance of early detection to improve outcomes and save lives. The literature review that was conducted focused on understanding the epidemiology of breast cancer in Nairobi, identifying key social and environmental challenges that hinder prevention, detection, and treatment efforts. In Kenya, cancer ranks as the third leading cause of death, with breast cancer being the most common type of cancer and second leading cause of cancer related deaths. Cancer cases in Kenya are projected to surge by over 120% in the next 20 years, driven by increased urbanization and exposure to carcinogens, particularly in higher urbanized areas just like Nairobi. The aging population, with currently over 40% under 15 years old, will see a rise in cancer incidence as it continues to grow. Additionally, unhealthy behaviors, including tobacco use and rising obesity, are significant contributors to this expected increase. Kenya experiences a higher breast cancer mortality rate compared to higher income countries due to later stages of diagnosis. Specifically, 44.2% of patients in Kenya are diagnosed with breast cancer, significantly higher than 17.5% in the United States. The critical factor contributing to the disparity is the stage at which diagnosis occurs. In Kenya, diagnoses tend to happen at more advanced stages. Global breast cancer survival rates are closely linked to a country's GDP and healthcare spending, with disparities evident in places like Kenya. In Kenya, 23% of sick patients avoid seeking care due to cost, distances, and low healthcare literacy. Kenya struggled with inadequate cancer care infrastructure and a general lack of awareness about cancer risk factors and prevention, highlighted by a study showing fewer than 10% of individuals in rural areas are knowledgeable of breast cancer risks. Numerous factors affect breast cancer survival rates, such as education, fertility rates, and the strength of the healthcare system. However, the stage at which cancer is diagnosed remains the most crucial determinant, offering a direct opportunity for short term impact through early detection initiatives. Early detection of breast cancer significantly enhances survival possibilities. For instance, patients diagnosed at stage 1 have about a 90% chance of 10-year survival, whereas those diagnosed at stage 4 see this likelihood plummet to approximately 5%. Breast cancer diagnosis in low and middle income countries, including Kenya, often occurs at an advanced stage. In contrast, the United States only sees only 11.6% of breast cancer cases diagnosed at such advanced stages. This is why it's so important to raise awareness and implement screening programs to address the early detection gaps in Kenya. The Pink Ribbons pilot program aims to empower individual women with actionable steps to reduce breast cancer risk, focusing on education and lifestyle changes. By evaluating its effectiveness in enhancing participants' awareness of breast cancer and the significance of early detection, the program seeks to make meaningful strides in combating this disease. In early April 2024, selected medical groups in Nairobi will collaborate to conduct education sessions focusing on communicating the benefits of early breast cancer detection, methods for detecting breast cancer, and lifestyle changes to mitigate risk. Participants will complete pre and post session surveys to gauge the effectiveness of the sessions in enhancing awareness and understanding of breast cancer among participants. Kenya's high cancer breast Kenya's high breast cancer mortality rate demonstrates the urgency for awareness and screening initiatives. The implementation of programs like Pink Ribbons Nairobi, started in April 2024, will work to educate women about breast cancer prevention strategies and lifestyle modifications to work towards improving breast cancer related deaths in Kenya. These are my references, and thank you so much for watching.